all, what do the cholesterol numbers in a blood test actually mean? A few days ago, a 42-year-old patient sent us his blood results. It was just a routine checkup and the lab report said elevated cholesterol. He was concerned and asked if he needs medication. There are generally 4 cholesterol values in any blood test. There's the LDL cholesterol, and that's the bad type of cholesterol that can build up in the arteries over time and block them. There's the HDL cholesterol, the good type that protects your heart by removing the bad LDL from the blood. There's the triglycerides, the fats used for energy when needed and that are stored in fat stores when you consume more calories than your body needs, leading to weight gain. And finally, there's total cholesterol, which is all types combined, not very useful in its own and usually the one that people focus on the most. The NICE guidelines in the UK use something called non-HDL cholesterol, which is the total cholesterol minus HDL. It gives a clearer picture of risk than LDL alone. This patient had a non-HDL cholesterol of 5.2, which is above the normal range. But in medicine, we don't treat cholesterol numbers, we treat the cardiovascular risk. So the step 1 is to check whether the patient had a history of cardiovascular disease. If the answer is yes, treatment is almost automatic because we call that secondary prevention. But this patient had never had any heart disease or any history of any of these things. So the next step is to move to the real deciding factor, something called his 10-year Q-risk score, which is a tool that estimates your risk of developing cardiovascular disease over the next 10 years. It takes into account age, sex, ethnicity, smoking status, blood pressure, cholesterol ratio, BMI, and other things. In the UK, NICE guidelines recommend offering a statin, which is the medicine that reduces cholesterol, if the Q-risk is 10% or higher. This patient's Q-risk score was 5.8%. This means he doesn't automatically need a statin. All he needs is lifestyle advice, such as exercise, diet, weight loss, and then repeat the test after a period of time and reassess and so on and so forth. If you want to understand your own blood results, you can upload your test results on our website or via WhatsApp link, and we will review them for you, explain them, and more importantly, explain the relevant medical guidelines applicable to your situation.